Today, we are going to look at a BodyViz brain builder about the vertebral column and sciatica. The vertebral column is part of the axial skeleton and is the central axis of the skeleton. It supports the head, protects the spinal cord, and serves as a point of attachment for ribs and the pelvis. Let's begin by learning more about the vertebral column and then sciatica. The vertebral column consists of individual bones called vertebrae and associated connective tissue composed of intervertebral discs and ligaments. There are 24 presacral vertebrae that you should know about. There are 7 cervical vertebrae, which support the weight of your head, 12 thoracic vertebrae, which each articulate with 1 or 2 ribs laterally, and 5 lumbar vertebrae, which supports most of the weight of all the other vertebrae. An easy way to remember how many vertebrae and the order is to remember the times of the day that you may eat at. For example, at 7 a.m. you eat cereal, which corresponds to the 7 cervical vertebrae at the top of the vertebral column. At 12, you eat tacos, corresponding to the 12 thoracic vertebrae in the middle of the vertebral column. And at 5, you may eat lasagna, corresponding to the 5 lumbar vertebrae at the bottom of the vertebral column. There are 2 composite vertebrae in the pelvic area following the lumbar section, the sacrum and the coccyx. When referring to a particular vertebrae, the notion utilized by anatomists is a specific capital letter followed by a subscript number. The letters refer to a particular region of the vertebral column, while the number indicates the specific vertebrae. For instance, T8 refers to the 8 thoracic vertebrae. Intervertebral discs are composed of fibrous cartilage and can be found between C3 and C7, all thoracic and lumbar vertebrae, as well as between the 5th vertebrae and the 1st sacral vertebrae. These discs serve to maintain the proper spacing between each vertebrae, as well as assist in the transmission of force between adjacent vertebrae. Each disc has an outer ring of fibrous cartilage, called the annulus fibrosus, and an inner gelatinous mass, called the nucleus pulposus. The term sciatica refers to the pain that radiates from one's lower back inferiorly through the buttocks, hips, thigh, and leg. Typically, this only occurs on one side of the body. The pain is due to compression of the sciatic nerve, often as a result of a bulging or displaced intervertebral disc within the lumbar region. Next, we will look at the symptoms, causes, and treatments for sciatica, and finally, give a patient example. The symptom associated with sciatica is pain radiating from the lower lumbar spine to one's buttocks and down the back of one's leg. This pain can range from a mild ache to a sharp pain, or be a burning sensation or excruciating pain, and is typically only experienced on one side of the body. The cause of sciatica is when the sciatic nerve becomes pinched. Usually this is because of a herniated disc or a bone spur on a vertebrae. Uncommonly, the sciatic nerve is compressed by a tumor or damaged by a disease like diabetes. Treatments to improve the pain with sciatica include prescribed medications like anti-inflammatories, muscle relaxants, narcotics, antidepressants, and actually anti-seizure medications. Physical therapy to help prevent the future injury and correct posture. Steroid injections to reduce pain and inflammation around the irritated nerve. And surgery to remove the bone spur or a portion of the herniated disc that is pressing on the pinched nerve. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age 35, gender male, chief complaints, excruciating pain from his left buttocks to the left leg with a burning sensation. You invite the patient into your office for an examination, and the patient is in so much pain that it hurts to walk and is brought in with a wheelchair. The patient has a very active lifestyle and a job as a construction worker that requires heavy manual labor. You order an x-ray which showcases a herniated disc that is pressing on his sciatic nerve at L4. Your diagnosis is sciatica from a herniated disc. You schedule a surgery to repair the herniated disc and provide relief to the compressed nerve. The patient experiences complete relief and must refrain from heavy twisting and lifting for the following months. This is a classic example of sciatica. For more anatomy explanations and patient case examples, please like this video and subscribe to our BodyViz channel for more.